My name is Dr. Gene Pizzolo. I'm the senior partner here at Progressive Oral Surgery. You've successfully completed the surgical phase of treatment. Welcome to recovery. Postoperative instructions for most oral surgical procedures are universal with few exceptions. Perhaps the patient's biggest complaint is bleeding and swelling. You may notice a gauze pad in the surgical site. It's imperative that you apply direct pressure against that gauze for a half hour without disturbing it. After a half hour, remove the gauze, wait a minute or two, check the site. Don't judge bleeding by the appearance of the gauze. Blood and saliva will always make the gauze deceptive. If there's no active bleeding, leave the gauze out. If there is, you'll be provided additional gauze. Take a piece or two, fold it in half, place it over the operative site, bite for an additional hour. Typically, it'll take an hour to 6 hours for bleeding to stop. Once bleeding stops, if you're hungry, you may eat. Soft foods are fine, nothing hot off the stove, warm to cold, anything just cooked, let it cool off a bit. No rinsing, spitting, or brushing for the remainder of the day. That will promote bleeding as well. Your next concern will be swelling. Cold packs or an ice pack wrapped in a towel held adjacent to the surgical site for 20 minutes will help with swelling. This should be alternated 20 minutes on, 20 minutes off for the remainder of the day. Ice will have no appreciable effect the following day, so it's imperative that you do this until bedtime the evening of surgery. Restriction and opening may occur following several oral surgical procedures. There's a muscle sling that runs from your cheekbone to the angle of your jaw and back up again. That muscle typically will go into spasm following surgery. It will restrict opening comfortably within a half to 2/3 of normal. So eating and speaking isn't problematic, but if you try to stretch to maximum, you'll be aware of the muscle pull. You may find moist heat helpful within 48 hours after surgery. If this restriction and opening does persist beyond a 10-day period, call your doctor. Postoperative pain is managed with the analgesics prescribed. They can range from ibuprofen or Motrin to a narcotic combination. Follow your doctor's instructions. It's imperative that you take the first dose before local anesthetic wears off. This way, the medication prescribed has an opportunity to be effective. Some narcotic combinations will cause nausea and vomiting. If either occur, call your doctor. Appropriate home care is imperative. No rinsing, spitting, or drinking through a straw the day of surgery. If you're a smoker, no smoking the day of surgery. The following day, you're allowed to brush gently, particularly in the surgical site. Some bleeding is expected. If sutures were placed by your doctor, it's not unusual to see some oozing for at least a 3-day period post-op. Postoperative infections typically occur on day 3 through 5. Patients will usually complain of increasing swelling, sore throat, fever, and pain that's no longer relieved with the analgesic prescribed by your doctor. If this occurs, call the office and speak to your doctor immediately. A local anesthetic was utilized by your doctor during surgery. Depending upon the type of local used, you'll be numb anywhere from an hour to 6 to 8 hours post-operatively. A suture may have been utilized by your doctor. The purpose of that suture is not to close the opening, but to control bleeding in the site. It's not unusual to see an open socket. This is not a defect. It will fill in a 6 to 8 week period. You may experience some persistent numbness beyond the 8-hour period mentioned previously. That may not be a permanent occurrence and is likely just due to swelling compressing upon the nerves. As the swelling resolves, so will a numbness. But with any concerns, once again, call your doctor. Socket preservation is a technique utilized in preparation for dental implants. The graft material itself is particulate. It's analogous to wet sand. Typically, it takes 2 or more weeks for it to firm in the mouth. It's not unusual during that period of time to notice some granules working their way free. That's not problematic, it's anticipated. In some instances, when dental implants are placed in the posterior aspect of the upper jaw, it's necessary to do a sinus lift or a sinus augmentation procedure. During this procedure, graft material is placed within the sinus, under the sinus lining. In addition to normal post-operative instructions, it's imperative that you do not blow your nose. A dental implant is a tooth root substitute. Your surgeon may have opted to utilize either a 1-stage or a 2-stage procedure. With a 1-stage procedure, you may notice a small polished cylinder projecting slightly above the gum. Chew on the opposite side of your mouth for at least a day of surgery and perhaps a 2-week period, depending upon your doctor's instruction. The following day, it's okay to brush adjacent to the site, but be careful when you're getting an approximation to the implant. A mild sore throat or a low-grade fever is anticipated on the day of surgery. Temperature exceeding 102 degrees Fahrenheit is problematic. Call your doctor immediately.